Today I'm going to demonstrate thoracic extension. This is a movement which typically relieves pain or discomfort in the mid-back of the body, and that's what the thoracic term means. Thoracic spine means the mid part of your back, right in the center. Not the lower, not the upper. There are many different ways to stretch the mid-back into extension. Today I'm going to demonstrate the way that I prefer to perform it and the way in which I find most patients find relief. Okay? The way that I like to do this is I like to provide what's called a fulcrum, or rather, I'm going to use a foam roller today, and I'm going to place this at the region of my back where I feel discomfort and tightness. So place it on the chair here. Okay, I'm going to place this, again, right in the mid-back, approximately at the level where I'm feeling some sort of strain or discomfort. Okay? And so I use the word fulcrum. Fulcrum means that it's a point of pressure which allows you to concentrate the movement at a specific area, namely that which feels uncomfortable. There are 3 different variations for hand placements I'm going to demonstrate today. I'll start with the most common one, where you place one hand on each shoulder on top, like so. Okay? And now while sitting in an upright position, I'm going to lean back and I'm going to push into the foam roller, and when I get to the point that I can't move any further, or I feel a sufficient stretch, I will hold for approximately 3 seconds. After the 3 seconds, I'll return to the starting position. Again, start in an upright position, a neutral position. Come on back, lean in, hold for 3 seconds, and then return to the neutral position. Typically, this is performed up to 5 or 10 times to get a better understanding of what the effect of that movement is on the body. Okay, let's demonstrate another hand placement. For this one, I will place my hands on either side of my neck, like so, while in this position. And I'm not grasping, I'm not grabbing my neck hard, I'm not pulling my head forward, they're just placed here lightly. This helps set the shoulder blades in a specific position, which may be helpful. And again, I will lean back into the stretch, hold for approximately 3 seconds, and then return to the neutral position. Again, lean back into the foam roller or the fulcrum, hold for a count of 3, and then return to the neutral position. It's helpful sometimes to change the position of the hands because that allows the person to gain more of a back bend. If you have a little bit of a stiff neck, or you have a neck condition, sometimes this is more comforting to hold your neck more or less in place. Again, lightly. You do not want to grip too hard. You don't want to influence the movement of your spine by pulling your head forward. The next position is a light hand clasp, like so. One hand with the thumb facing down, one hand with the thumb facing up, and then both fists will be about chest level directly in front of the body. There will be a slight opposition where you're pulling your hands away from each other. Again, a light force here. It allows you to stabilize your shoulder blades. And then lean back into the foam roller, bend backwards, get to the maximal stretch that you can perform at that time. Hold for 3 seconds, and then return to the neutral. Again, lean back. Remember to breathe. And then return to the starting position. Sometimes taking a breath out at the end of the stretch allows you to go a little bit further. The purpose of this stretch is to provide relief to tight or painful areas of the mid-back. If you're doing this on your own without any instruction, always be slow and gentle with the movement. If it provides relief, that's great. It should be fairly safe for you to perform. But take inventory. How did you feel before you began the stretch? How did you feel during the stretch? And how did you feel after you performed it? That gives you a better idea of the true nature of the effect of the movement. All right, thank you very much.